So a lot of people come up to me and ask me, what is integrative medicine? What is integrative oncology? So I will try to touch on that briefly. I'll talk about the evidence surrounding integrative medicine in kidney cancer and general in cancer. We will go through some of the resources that we have here at the Integrative Medicine Center, and I'm not sure we'll have time for questions. If we do, then I'm happy to answer them. So the Society of Integrative Oncology defines integrative oncology as a patient-centered, evidence-informed field of cancer care. We primarily focus on lifestyle endeavors, but we also talk about those complementary and alternative therapies that are out there and synthesize that along with a conventional treatment plan. So we try to navigate all of the research that's out there, a lot of the non-evidence-based interventions that people have questions about or are doing, and really come up with the safest, most efficacious treatment plan. This is a graphic offered by the National Center for Complementary and Integrative Health. This is the branch of the NIH, the National Institute of Health, that focuses on complementary and integrative therapies. And I love this graphic because it kind of embodies all of the medical system and then highlights many of the integrative components and how they overlap and fuse with a conventional medical system. So the spectrum goes from the pharmaceuticals, the drugs, all the way to the surgery, to the radiation, and integrative components can be sprinkled within that in every realm. So integrative medicine is applicable to all aspects of medicine. My mentor, Andrew Weil, says integrative medicine is just good medicine. Maybe one day we'll just call it medicine, not integrative medicine. So a paradigm shift has been going on over the past decade in that many of the guiding bodies in oncology have embraced the integrative approach and are now taking the research base that is building and incorporating them into established guidelines. And this is wonderful because when entities become folded into guidelines, they're getting to the clinicians, they're getting to the patients that can benefit from this care. So the more we have ASCO and SIO supporting our endeavors and recommending these integrative therapies, the more our patients are going to be receiving the benefit. So I'd like to introduce you to our clinic. We have 2 advanced practice providers and then 4 clinicians working in our center. And essentially, we offer integrative consults, which are 1-hour consults, mostly virtual, although we are coming back to in-person, where we discuss everything related to an integrative approach. So that can be how to manage symptoms from an integrative perspective using acupuncture and massage, and maybe your interest in mind-body and our referral to our mind-body specialist who does yoga and breath work. You may have questions about your medications and pain management. My training is an internal medicine physician, as is Dr. Lopez and Dr. Narayanan, and we all have some experience with cancer care. Dr. Lopez is a hematologist oncologist. And then Dr. Ramondetta is our Gyn-Onc faculty. So she has expertise in integrative Gyn-Onc. And essentially, we talk to you about your care plan and help formulate an integrative approach along with your primary care team. So we provide these personalized recommendations. And I would say a large part of what our consults entail are talking to patients about lifestyle endeavors and questions about supplements and herbs. So this is a graphic of all of the integrative approaches that we offer for various symptoms. So you can see that pain symptoms are benefited from the use of acupuncture, massage, and mind-body or meditation, fatigue, sleep issues, anxiety. And so we go into the details there, talk to you about what you're experiencing, of course, talk to you about lifestyle factors that could improve this, and then our touch-based therapies, which are predominantly very low risk, relatively non-invasive, and can complement whatever your conventional team is offering you. So we have 2 health psychologists on our team as well, and they lead group classes that support our patients in lifestyle changes. So they have a group called I Am Healthy and a group called I Am Fit that is virtual, 100% virtual right now. And this is for patients who are interested in making changes, but would like a little bit of peer support as well as psychology support or behavior change support to make these changes. So this would be one indication to come see us in the Integrative Medicine Center, and we can talk to you about getting enrolled in these classes. We have hybrid visits with our physical therapists, our dietitians, our yoga therapists, and music therapists. So if you prefer to see a clinician one-on-one, you can come into our center, which is located at the Life Science Plaza on Holcomb near Pressler, or we can meet you virtually. And then, of course, touch-based therapies like oncology and massage are in person. So the American Institute of Cancer Research recommends various lifestyle endeavors, and this is based on very solid research over the decades. Majority of it is coming from observational data, so looking at tens of thousands of people and populations and how certain behaviors impact their outcomes with cancer. And these are the recommendations to prevent cancer, but we also feel that they are as beneficial in patients already with cancer in terms of optimizing outcomes, improving quality of life. So these are the various entities based on evidence that we will discuss in our consults, and that we want to be discussed in all clinical encounters, or at least to be referenced. So what does the research say on lifestyle behaviors in cancer? This is a more visually easy to read graphic, but essentially a comprehensive approach is going to be the best option. You know, in conventional science, we love the randomized control trial where we have one intervention and then we have a control, and we do this one by one. But in lifestyle endeavors, it's very hard to do that, right? We can't just keep you on one particular diet for very long, or just have you do one type of activity. And so we synthesize the information from a comprehensive standpoint, and we believe that this synergistically can impact your outcomes. So physical activity, I'll get a little bit into more details with that, but that has been shown to help many aspects of quality of life, your energy level, sleep, diet quality. I won't go into too many details because Carrie Daniel McDougall will be here talking to you about all of the wonderful aspects of food and how this can impact your trajectory. Sleep is essential. Social attachment and community is always very important. And then how can we mitigate stress and reduce that sympathetic overload, that cortisol release, to allow your body to recover and heal? And then part of this is also toxin reduction. So how can we try to minimize exposures to substances and toxins in the environment? So I do love this quote, and I included in it because it is very hard to change behavior, and it's very hard to change a person's eating pattern. But I will say, this is Margaret Mead, an American anthropologist from back in the day. But I will say this is one of the most important aspects of your journey. And just in the past, I would say 50 years, when we've seen the industrialization of food, we've seen this blossoming of chronic diseases and cancer as a result of the food that we eat. So I won't, again, we'll have Carrie talk to you about that, but I can't stress enough the importance of nutrition and making the right food choices. So when I'm speaking to clinicians, and I used to teach medical students and residents, I used to encourage them to write food prescriptions for your patients, just to give very objective information. So what I would say to you is try to minimize processed food, sugary beverages, really increase your veggie and fruits, adjust portion sizes. If you're not able to eliminate certain aspects of your food, eat more of the healthier thing, less of the more indulgent thing. If you're really into trying to buy organic, the Environmental Working Group is a great resource to look at the Clean 15 and the Dirty Dozen. And then there's a whole burgeoning area of research about the gut microbiome and how we can boost our immune system and impact our health through foods that support our microbiome. Now, movement and physical activity is just as important. Specific to kidney cancer, we have seen a study that there's a 12% reduction in kidney cancer associated with high levels of exercise compared to low levels of exercise. And then another study in 2017 showed that any exercise versus none reduced kidney cancer mortality by 50%. We know, to speak about the synergistic impact of exercise, we know that this helps our energy balance, it helps keep our muscles engaged, which helps to balance many other aspects of our immune fighting and our stress systems. In cardiovascular research, we know that light activity versus sitting 30 minutes daily led to a 17% risk in dying. And then if you just reduce your sedentary time by 1 hour, you're lowering your risk of heart disease by 1/4. You don't see those numbers in medicine very often. This is really impactful. So get up, move around, do your exercise snacks. And if you want to work with a trainer, we do have a physical therapist in our integrative center who can help develop an exercise plan for you. So this is just the exercise prescription that we would recommend. Start with small, achievable goals, do something small. Every watch now has a fitness tracker that you can use, as well as YouTube videos and apps. And then, of course, finding a buddy to hold you accountable can make it more achievable. So this is our center. We do offer virtual classes, including yoga classes, a writing class, and a music class. And so you can join in these classes as an MD Anderson patient and do yoga with Smitha, our mind-body specialist, in the comfort of your own home. But again, if you wish to meet with us for an integrative consult, you would just speak to your primary care team and request that a consult be placed, and then you'll be put on our schedule so we can talk a little bit more specifically about what your interests are and what your needs are. These are the mind-body apps that I've recommended, and if you're interested in downloading them and checking them out, these are they. I wanted to touch briefly on supplements and off-label pharmaceutical uses, because this, as I said, is one of the main things that we encounter in our clinics. And it's very important to have this conversation with your primary oncologist and disclose to them if you're taking anything. And then we're happy to go into the details about the benefit and the risk of certain supplements. So the research is all over the place with supplements, and I highlighted here a few of the supplements that have stronger research in the realm of cancer. But that being said, there's always a caveat and something that we need to be cautious about. So please do come to us and have this conversation, and we can hear what you would like to achieve and balance the risk and the benefits. These are some of the resources that we use in the clinic that are based on evidence. And so we do a lot of cross-checking for interactions, efficacy, and try to keep up on a regular basis with all of the evidence that's coming out. It's prolific, the amount of research coming out on supplements and probiotics on a daily basis. So with that, I don't know if we have time for questions, but please do reach out to your team and request an integrative consult if you would like to be seen by us.